All right. Good afternoon, everyone, and welcome to this week's edition of It's Worth a Shot, hosted by your Mountain Pacific Quality Health Partners. My name is Jessie Kinsey. I'm a registered nurse and account manager with Mountain Pacific. Today is March 8th, 2023, and we will be discussing COVID-19 outbreak mock survey tools, as well as looking at emergency preparedness planning. Next slide, please. Few updates. Just wanted to touch upon last week. We did share out some updated vaccine flyers. One was more resident or patient focused. The other one was more community focused. As there continues to be flu circulating, the recommendation remains that there is still time to receive your flu vaccine. So for folks looking for some additional supporting information or materials or educational reference, just a little reminder that these have been released. They're posted to our website. I know a few partners have picked them up and ran with them. So next slide, please. As always, feel free to add your webinar topics or ideas into chat. We'll continue to meet every Wednesday, and we have a polling question. I'll let you pull that up for me, Jamie.
I am working on it.
Okay. Looks like we have a few folks still joining us, so perfect timing. If we need to save it to the end, we sure can do that too.
Yep, I might need to do that.
Okay, all right, no problem. Next slide, please. So as always, oh, there it is. There it is. Okay. So polling question for this week, is your center recommending COVID-19 vaccination upon admission? This has kind of come up as a hot survey topic recently. So again, is your center recommending COVID-19 vaccination upon admission, yes or no? I'm not sure if folks can see that polling question. Audience members, does anyone want to chat in and see? Let me know if you can see that. Okay, thanks.
I can see it.
Okay, thanks. I'm not able to see any participation, so that's why I wasn't sure.
Looks like we have 71% at yes and 28% at no.
Okay. All right, we'll go ahead and round that out then. Thank you guys for participating in that. All right, so kind of per our norm, we'll take a quick look at our weekly influenza snapshot. Again, there is still flu circulating throughout the country. So still, there's some time to get a flu vaccination for this season. Although we are seeing a nationwide decline, which is fabulous and wonderful. That's where we want to be headed. Just be mindful of your surrounding region, state, area, county. And I went ahead and inserted week ending February 25th for the United States map, just so you can see that there is some hot spots around the country as far as high circulation of or high activity for influenza. And as we look at our weekly COVID-19 snapshot, wonderful news. Cases continue to be on the decline, as well as deaths and hospitalizations. Our vaccination uptake for the updated COVID-19 bivalent booster, we're seeing some small improvements there, where we finally broke loose of the 15% and we're into the 16th percentile for those within our population receiving the booster. So wonderful news there. Just a couple updates. The CDC presented new data that was last last week or the tail end of the week prior, showing that the updated vaccines, again, they protect people against those current variants. So those bivalent vaccines are shown to be effective. The committee expressed support for streamlining and really simplifying our COVID-19 vaccine recommendations for this fall. So what came out of that, and you guys have seen some introductory communication already, is that they will be phasing out the original monovalent, again, just the monovalent vaccines, and replacing them with the updated bivalent vaccines. So stay tuned for more information there. Next slide, please. And we had just a couple questions from our wonderful session regarding our NHSN data entry training last week. First question that popped up quite a few times that we wanted to share forward. If I enter the flu data for the entire critical access hospital, my CA, which includes the long-term care center, do I need to enter that long-term care center in separately? And the answer to this was yes. You will need to enter it in that separate module. And I will just say, feel free if you have additional questions to pop those in chat and we can connect you with some one-on-one support. The second question, when is the deadline to enter flu data for my long-term care into NHSN? That flu data will need to be reported for at least one time for this season by May 15th. So that deadline is May 15th. Again, any questions, you can pop those in chat and we can connect you with some one-on-one support as you look at NHSN data entry. All right, next slide, please. So I'd like to welcome and introduce my coworker, my peer, joining us from Wyoming, Callie Perkins, and she's going to be discussing COVID-19, some mock survey tools that we've developed. Callie, take it away.
Okay, thanks, Jessie. Hi, everybody. Good afternoon to everybody on the west side. I guess it might be morning still for you guys. Let's go ahead and go to the next slide. Okay, so like Jessie said, we are introducing a new Mountain Pacific resource, which we have created for you guys. This resource I'm actually really excited about because this was a resource that a facility had asked for. So you guys ask and we try to, make good on that. So here is our Mountain Pacific. It's a COVID-19 mock survey tool. It is based upon the CMS 20054 survey tool. What we've done is we took that survey tool and we cut out all of the other information that you didn't need, and we kind of cut it down to just the COVID specific areas. So it does cover the F880, F882, all the way to F888. F881 is listed on there, but that is specific to the antibiotic stewardship. So this tool does not go into that. But the idea behind this is just to help you guys prepare for a survey and get you ready. Make sure that you have all of your policies in place and any precautions that you guys need to do or education you need to do. This tool is just a great way for you guys to take a look at your processes and make sure that you guys have what you need. Next slide. Okay, so just a couple of features about the tool itself. It does go over policy and procedure development, like I mentioned. So if you guys do not have specific policies, it'll kind of prompt you guys to take a look at those policies. Maybe they need to be revised or updated. It also covers access to supplies. This is one thing that if your staff don't know where to find supplies, you might as well not even have them if they don't know where to find them. So it kind of goes over that and some education points that you can do with your staff on that as well. One of the other things that we've identified is disinfection and using the proper disinfectant wipes or disinfectant for COVID-19 specific. So if you access this tool from our website, there's hyperlinks to the end list. So you guys can pull that up and see if the disinfection wipes or cleaners that you guys use in your facilities are good for COVID-19. At the very end of this tool, it has 14 different prompt questions. So if you guys are answering no to any of those, that would then prompt you to revisit some of your policies and procedures. It also covers state-specific for our region only, state-specific outbreak reporting guidance. And we have discovered that some facilities were kind of struggling about when to report and who to report to. So we went ahead and included that right in this resource. And of course, we always like to share our Mountain Pacific resources. So on one of the pages in there, again, if you bring it up, it'll take you directly to those links for Mountain Pacific resources. While we were reviewing this, oh, sorry, go ahead to the next slide, please. One of the questions that kind of continually comes up and it's addressed in this tool is the vaccination for facility staff. It covers all of the components for policy and procedure, your exemption process, your tracking, and it also covers what to do for your unvaccinated staff. Let's go ahead and go to the next slide. So one area that we've recognized that our nursing homes and our facilities struggle with is what to do for unvaccinated staff. And I specifically pulled this, it's right in the tool itself. But just so you guys are aware, facilities have the discretion to choose which additional precautions to implement. And the thing to remember with this is that nursing homes have to show that they are trying to mitigate the transmission and spread of COVID. So make sure whatever policies and procedures you put in place for your unvaccinated staff that you're showing an attempt to mitigate the transmission and spread of COVID-19. So with that, I've also seen where facilities they have one thing in policy, but it doesn't actually match their practice. And that's another good thing that this tool can do is it'll take you through policy, but then you can also review your processes to make sure that your processes are matching policy or that policy doesn't need to be updated or revised as well. This is just one really good example of that. And again, we've seen facilities struggle with that one a little bit. Next slide, please. So, and again, these are just the links to the mock survey tool. And then this one will actually take you to the full nursing home tool. So the second link here. So do you guys have any questions on this resource tool? Okay, if you guys do, go ahead and just plug those into the chat and we can kind of circle back on that. Again, moving forward, if you guys have tools and resources that you would like to see or, are in need of, just ask. I was really excited to do this one. Again, a facility had said, hey, it would be really great to have a tool that we can walk through our facility as if we were in an outbreak status or if we had survey come in. So again, let us know if you guys are interested, and we will send out the links with the notes for today. Okay, and I'm going to turn it over to Larissa, who is a Wyoming account manager with me here at Mountain Pacific. She is going to talk about emergency preparedness planning and why it is important. Thank you, guys.
Perfect. Thank you so much, Kelly, for the introduction. As Kelly mentioned, my name is Larissa Skinner, and I am an account manager here in Wyoming. And so today we're going to talk about why is emergency preparedness something that we should all be focusing on. It is an area that we have been tasked from CMS in some of the guidance and the information that we need to work on passing on to you guys. So if we can go to the next slide. Thank you. So the objectives for today will be to identify the disasters and emergencies that could occur, recognizing the importance of planning, recognizing special issues, as well as recognizing how to recover from a disaster or emergency. Can we go to the next slide? Perfect. And so then the question is, right, I think we all, coming from different backgrounds and different areas of expertise, I myself come from a long-term care facility background. We are all often thinking, how ready are we? If something would, happen, how prepared are we to act on? And so why is planning important? Just like any other type of emergencies or situations, if you're planning, you're going to look at reducing your fear or anxiety of the issue happening. You're going to look at the reduction of the impact of the disaster, know what to do in the cases of those emergencies, and your ability to care for yourself as well as the others, including your residents or patients, when emergency resources are stretched. In those cases, we need to think about things that are affecting a large group of facilities or settings. How do we go about it? So we can go to the next slide. So here are just some examples of some of the emergencies. And I feel that often when we think of emergencies, we often think about some of the major ones that we see in the news or on the television or nowadays in social media. But we tend to forget about others that can occur really anytime or any day, regardless if we are prepared or not to deal with them. Some of those that comes to mind that we hear from time to time are things like a major water line break, frozen pipes in cold states. I think majority of our states, other than the lucky ones in Hawaii and Guam, we tend to deal with severe weather. Also extreme heat and loss of cooling systems. There was a facility in the South that had experienced issues with their cooling system, and it was, all over the news. And unfortunately, there were a lot of negative incidents that came from the lack of cooling systems due to the extreme heat. Other things like extended power outages or internet outages. A lot of facilities, I would say probably all of them nowadays, are functioning under the electronic health record. And so what do we do if we cannot access one of our patients' chart? And then the big one, that's the one that we are dealing with for the past 3 years, which are pandemics and other healthcare related outbreaks that can really stretch our systems to the limit. And so we need to know how to work together. So if we can go to the next slide, please. Alrighty, so now we can talk about developing a plan. So when you're creating or reviewing your emergency preparedness plan, it's important to involve really a multidisciplinary team to participate, as everyone can bring different and important input to your facilities plan. And those folks should be, if you think about your own plans, you should be bringing people from hopefully each department in your facility, because every department should be involved in some kind of function as part of the emergency preparedness plan. So prior to the development of the emergency preparedness plan or doing the review process, which by the way should take place at least once a year. Obviously, if we can review that more often, especially with staffing changes or so on, the more you're looking into your plan, the better. You should also consider doing a risk assessment, because you really need to look at what are the higher needs that need to be addressed in your emergency preparedness plan. Majority of you guys listening in today are in probably long-term care facilities or folks assisting the elderly. And so you need to really look at what are essential needs that we have to be able to provide to those folks in cases of emergency. So it is important to know your facility's needs also based in the communities that you serve and the supporting organizations in place to support you in those efforts in those cases. So if you are reviewing your plan and you are relying in a setting or a group of settings just to provide things such as water, food, supplies, PPE, all those things. What happens if this one agency is no longer a provider or no longer has the capacity to provide for all the facilities in the region? And so reviewing that is extremely beneficial in updating. And then so if you find an area where, there's a need, but it cannot be met by our, the community or whatever agency, then you have the time to plan and try to find some other resources that can meet that gap. And then also during the development of the emergency preparedness plan, key staff members should not only be assigned their specific roles and tasks, but they should also be very involved in drills and rehearsing that plan. And that should really happen very routinely. So we all know we're busy in the, in the work that you all do. But if we're not rehearsing and practicing what we're, tasked with, in a case of an emergency, that line of defense per se might really break. And so now you have residents who are relying on you and you can no longer progress in their care. And often we hear that, drills really get overlooked. So I know facilities, they will have fire drills, they will have some of those bigger drills, but I challenge you to put your systems to the test and, kind of looking for those windows of opportunities that you have to maybe bring in some of those real type of scenarios and run with it. You have all staff meetings, you have, we have, as far as management, there's usually a QAPI meeting. There's all those windows there that you can really try to bring in a real type of scenario and work through it, like truly not just how you're going to evacuate, but also who is going to call where, what systems are going to talk to who is responsible for what, because ultimately I know from previous experiences, I knew I had a role in the emergency preparedness. But if it truly came down to it, to re-understand the significance of each individual's roles, if you're not rehearsing, you're probably not going to remember. So just like, at home, we should be practicing certain things. At work, we should be practicing those too. So if we can go to the next slide. So here are, for some of you folks, you may not know, but I believe a lot of you do. Mountain Pacific, we are the QIO for a few states. So we have Alaska, Guam, Hawaii, Montana, and Wyoming. And so we decided to create resources. And part of the resources that we felt was important was to list state-specific as well as federal agencies and supporting type of facilities to really help you guys in developing your plan or maintaining your plan. And so here's a list of just a few. I'm not going to go into detail just for the sake of time, but just know that in our resources, we have one of the resources that we created was a partnership for community health emergency preparedness plan guide. Boy, that's a mouthful. In there is a pretty, I won't say exhaustive, but a pretty lengthy list of resources for each one of the states as well as federally. So we're going to show you how to access some of the tools that we have created. So we can go to the next slide. So then, the question is, there's a lot of questions and that comes to my mind, especially the more I became more familiar with emergency preparedness plan. As we know, CMS is our main regulatory agency that oversees a lot of the work that we do, which is really not different with emergency preparedness plan. So in 2021, there was a new QSO, and I listed in here just the basic information that was provided. It's a pretty lengthy QSO that was really published specifying our roles in emergency preparedness plan and to ensure that our residents or patients will be cared for during those times. So I highly encourage that you review the guidance if you have not yet reviewed, and make sure that your key staff have a really good understanding of the roles and really why they have those roles. A lot of times you see the roles are kind of department specific, but there is an overlap in many occasions depending on how the facility is ran. So if we can go to the next slide. So how I mentioned before, Mount Pacific, we developed several tools to help you in really this really important test that you have. We created this little snapshot of our website and ultimately how you will access some of those tools that we have. If you follow, and the slides will be going to you guys via email, so I'm not going to spend a lot of time in going through the website. But if you guys have any questions or concerns in accessing some of the tools that we have on our website, please don't hesitate to reach out to any one of us. We'll be happy to walk you through. One little note I'd like to make here, when you guys are trying to access any one of our tools, when you click on that tool, so let's say you are going to look at an emergency preparedness plan tool. When you click on that tool, it's going to ask you for your name, your email address, as well as the facility where you work at. And please, I want you to know there is absolutely no other reason to gather that information other than it helps us in directing the work that we do. And so if we're seeing that there is a high demand and there's a lot of people accessing some of the tools that we have developed, we might really look into what else, our individuals that are doing the hard work, what else are they needing? So and so when you put that information in there, you submit it, you will have access to the tool automatically. It's going to pop a little window, a little blue box in there. You just click in there and you have access to the material right away. So I just want to note that because I know in the past there has been some confusion in accessing some of our tools. So if we can go to the next slide. So then here's a list of the tools that we have developed so far. We have a wonderful team, Callie, who presented to you guys right before I did. She has been involved in emergency preparedness planning at many different levels and has greatly guided a lot of the work that we have done in sharing and creating those resources. So I'm not going to go through each one of the tools. Like I said, they're on our website. But one area that I would really like to focus a little bit is the importance of what are the lessons that you learn after a facility or community experience some type of emergencies, right? So one of the tools that we created, and Shaylin has been also one of our account managers in Montana. She was pretty instrumental to the development of this tool. It's the after action plan. And so this is a tool that will guide you in how to be better prepared, follow an occurrence. It is important that you think about what changes that you need to put in place, changes to your policy, maybe new policies or practices to really grow with each one of the occurrences that happen. Because really, in my opinion, when some of those systems are challenged, right, and every day, that's where our learning comes from. So if we're, always doing the right things, there's a good chance that we might be missing on somewhere. So I highly encourage, utilize the tools. Like I said, reach out to us anytime with any questions. If we can go to the next slide. And then here are just some of the, a few more resources. One of our roles as a quality improvement organization is really to, if we don't have the answer, is to connect you guys with organizations that are already in place to really expand your ability to positively impact the lives of the people that you touch every day. So if there's ever a concern that you have, a tool that you're needing, if we don't have that, the actual information, we will connect you with the right individuals. So here's just a list of some of the resources and trainings that have been looked through pretty carefully with us. And so there's different states. So feel free to access any of them. And if we can go to the next slide, I think that might be our last one because I know we're getting short on time. Here are just some other resources, again, more specific. There was a slide previously, and I just thought I'll add some of the web links to some of the resources that we discussed. And then I want to really briefly open up to any questions. If anybody wants to come off mute or put any questions in the chat that we can address. All right, no brave souls out there. Anyway,
Larissa, it looks like Cindy made a really good comment about Alaska. Don't forget earthquakes.
Mm-hmm.
And then, Montana too. really.
Right?
And Hawaii. So yeah, don't forget earthquakes. And I suppose Wyoming. So really everywhere.
Mhm. And and that's the thing. It's, even without being the big ones, if there's a flooding, if there's a fire, if
Right.
there are all those things, it is so important that we are well versed into our tasks. So, because ultimately there's a reason why we have, folks are living in long-term care facilities is because they can't just a lot of times get up and take care of themselves. And so that's a huge task that we have, is to keep them folks safe. Um, so I think that ends our presentation for today. I really thank you guys for being part of this call. Jessie, is there any other closing thoughts before we end our call today?
No, I don't think I see any more questions in the chat. Please reach out to us if you need any assistance with your emergency planning. We're happy to help you. Thank you, Larissa. Thank you, Callie, and look forward to seeing everyone next week, same time, same place, and take care and be well. Thanks, everyone.